Hello everyone and welcome back to my channel. In this video, I will be discussing the causes, symptoms, and treatment options for onychomycosis. I will also be sharing some tips for preventing and managing toenail fungus. I hope that this video is helpful for anyone who is dealing with onychomycosis or is interested in learning more about this common nail infection. Onychomycosis, also known as toenail fungus, is a common nail infection that can cause nails to become discolored, thickened, and brittle. It is often caused by a fungal infection and can be difficult to treat. Onychomycosis, also known as nail fungus, is a common fungal infection that affects the nails. It can cause the nails to become discolored, thickened, and brittle. Onychomycosis can affect both the fingernails and toenails, and it is usually caused by dermatophytes, a type of fungus. It can be difficult to treat and may require long-term therapy with antifungal medications. Onychomycosis can be contagious. It can spread from person to person through direct contact with an infected nail or through contact with contaminated surfaces, such as floors in public places like locker rooms, showers, and swimming pool areas. It is important to practice good hygiene, such as washing hands and feet regularly, wearing clean socks and shoes, and avoiding sharing nail grooming tools to help prevent the spread of onychomycosis. The symptoms of onychomycosis can vary depending on the type and severity of the infection. Common symptoms include 1. Thickened, discolored, or yellowed nails. 2. Brittle or crumbly nails. 3. Distorted nail shape. 4. Buildup of debris under the nail. 5. Separation of the nail from the nail bed. 6. Foul odor coming from the affected nail. Onychomycosis typically starts at the tip of the nail and may spread to the nail cuticle and nail bed over time. It can cause pain or discomfort, especially if the infection is severe or affects multiple nails. If you suspect that you have onychomycosis, it is important to seek medical attention for an accurate diagnosis and appropriate treatment. There are several steps you can take to help prevent onychomycosis. 1. Keep your nails clean and dry. Wash your hands and feet regularly and dry them thoroughly, especially between the toes and under the nails. 2. Trim your nails properly. Cut your nails straight across and avoid cutting them too short to prevent trauma to the nail that can increase the risk of infection. 3. Wear proper footwear. Wear well-fitting shoes and breathable socks made of natural fibers to help prevent moisture buildup. 4. Practice good foot hygiene. Regularly clean and dry your feet, especially after activities that cause sweating, such as exercise or being in hot weather. 5. Avoid walking barefoot in public places. Wear flip-flops or shower shoes in communal areas like locker rooms, showers, and swimming pool areas to reduce the risk of exposure to fungal infections. 6. Avoid sharing nail grooming tools. Do not share nail clippers, files, or scissors with others to prevent the spread of fungal infections. 7. Treat skin infections promptly. If you have a skin infection, such as athlete's foot, treat it promptly to prevent it from spreading to your nails. By following these preventive measures and maintaining good hygiene practices, you can reduce your risk of developing onychomycosis. That's a good idea! Keeping your own set of nail grooming tools and using them exclusively can help prevent the spread of infections, including onychomycosis. It is important to regularly clean and disinfect your tools to maintain hygiene and reduce the risk of fungal or bacterial contamination. Additionally, replacing tools that show signs of wear or damage can also help prevent the introduction of microorganisms that can cause infections. Thank you for taking proactive steps to protect your nail health. The duration of treatment for onychomycosis with antifungal medications can vary depending on the type and severity of the infection, as well as the individual's response to treatment. In general, treatment for nail fungus can be lengthy and may require weeks to months of consistent use of antifungal medications to effectively eradicate the fungus and promote the growth of healthy nails. Topical antifungal treatments, such as creams, ointments, or nail lacquers, are typically applied directly to the affected nails daily for several months. Oral antifungal medications may also be prescribed for more severe cases or infections that do not respond to topical treatments, and these medications are generally taken for several weeks to months. It is important to follow the treatment regimen prescribed by your healthcare provider and to continue using antifungal medications as directed, even if the symptoms improve, to prevent the recurrence of the infection. In some cases, additional treatments or a combination of therapies may be necessary to effectively treat onychomycosis. It is essential to consult with a healthcare professional for an accurate diagnosis and personalized treatment plan for nail fungus. There are several treatment options available for onychomycosis, depending on the type, severity, and location of the infection. Treatment options may include 1. Topical antifungal medications. These are applied directly to the affected nails and are often used for mild to moderate cases of onychomycosis. They may include antifungal creams, lotions, or nail lacquers. 2. Oral antifungal medications. These are prescribed for more severe cases of onychomycosis or infections that do not respond to topical treatments. Oral antifungal medications are taken by mouth and are typically used for a period of several weeks to several months. 3. Surgical or debridement procedures. In some cases, the healthcare provider may recommend removing the infected nail to allow topical or oral antifungal medications to better reach the underlying nail bed. Surgical procedures can be considered for severe or recurrent cases of onychomycosis. For laser therapy, laser treatment may be used to treat onychomycosis by targeting and destroying the fungus in the nail without affecting the surrounding tissue. This non-invasive procedure is relatively new but has shown promising results in some cases. 5. Home remedies and natural treatments. Some individuals may try home remedies or natural treatments, such as tea tree oil, vinegar, coconut oil, or essential oils, as complementary or alternative treatments for onychomycosis. It is essential to consult with a healthcare provider before using these remedies to ensure they are safe and effective for your condition. It is important to seek medical advice for an accurate diagnosis and treatment plan for onychomycosis. Your healthcare provider can recommend the most appropriate treatment based on the type and severity of the infection and your individual health needs. They can also provide guidance on how to use prescribed medications effectively and how to prevent the recurrence of nail fungus. While antifungal medications prescribed by a healthcare provider are typically the most effective treatment for onychomycosis, some individuals may consider using natural remedies as complementary or alternative treatments. It is essential to keep in mind that natural remedies may not be as potent or scientifically proven as traditional medical treatments, and their effectiveness may vary from person to person. Here are some natural remedies that are commonly used for treating nail fungus. 1. Tea tree oil. Tea tree oil has natural antifungal properties and is often used topically to treat nail fungus. It should be diluted and applied directly to the affected nails. 2. Vinegar. Soaking the affected nails in a mixture of vinegar and water may help inhibit the growth of fungus. Apple cider vinegar is commonly used for this purpose. 3. Coconut oil. Coconut oil has antifungal properties and can be applied topically to the affected nails. 4. Essential oils. Some essential oils, such as lavender oil, oregano oil, and clove oil, have antifungal properties and may help combat nail fungus when applied to the affected nails. 5. Baking soda. Baking soda has antifungal properties and can be used as a paste or added to foot soaks to help treat nail fungus. It is essential to consult with a healthcare provider before using natural remedies to ensure they are safe and suitable for your individual circumstances. Additionally, it is important to be patient and consistent with the use of these remedies, as natural treatments may take time to show results. If you have concerns about treating nail fungus, it is best to seek advice from a healthcare professional for personalized recommendations and guidance. Tea tree oil and vinegar are popular natural remedies that are believed to have antifungal properties and may help with nail fungus. It is essential to use them properly and consistently to see the best results. Here are a few tips for using tea tree oil and vinegar for nail fungus treatment. Tea tree oil. 1. Dilute the tea tree oil with a carrier oil, such as coconut oil or olive oil, before applying it to the affected nails. 2. Apply the diluted tea tree oil directly to the nails using a clean cotton swab or brush. 3. Repeat this process daily until you see an improvement in your nail condition. Vinegar. 1. Mix equal parts of vinegar and water in a basin or container large enough to soak your feet or hands. 2. Soak the affected nails in the vinegar solution for about 15 to 20 minutes. 3. Pat your nails dry thoroughly after soaking and repeat this process daily. It is essential to be patient and consistent with the use of these natural remedies, as it may take some time to see noticeable results. If you have any concerns or if you notice any adverse reactions, it is best to discontinue use and consult with a healthcare provider. Additionally, it is always a good idea to seek medical advice for a proper diagnosis and personalized treatment plan for nail fungus. Good luck with your treatment, and I hope you see positive results. Thank you for watching, and don't forget to like and subscribe for more videos on health and wellness. Take care and see you in the next one.